Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over wound care in immunocompromised patients. But first, if you could smash that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So immunocompromised patients do represent a significant challenge in wound care because we need a functioning immune system for optimal healing, okay? We need our white blood cells, our cells to be functioning properly to properly heal a wound. So it is a well-documented risk factor for delayed wound healing, prolonged infections, and sepsis. Okay, so wound care specialists need to be aware of specific challenges and best practices while providing wound care to these patients. So how does immunosuppression delay wound healing? So our immune system plays a critical role in our normal wound healing. So when we normally have an injury in our tissue, the immediate recruitment of immune cells starts, okay? In people who are immune suppressed, this is delayed. Okay, so cells from both the innate and adaptive immune system are impacted with wound healing. So the innate cells such as neutrophils, macrophages, dendrites, T and B cells, they create our immune system, okay, to help the wound heal. And cells such as neutrophils, okay, they are the first line of offense. So they are there first. When we don't have this and it's delayed, it creates a bunch of problems, delayed wound healing, infection, whatnot. So several conditions can impair the function of the immune system. So diabetes mellitus, HIV, AIDS, cancer, autoimmune diseases, immunosuppressant drugs, organ transplants, they can all affect the wound healing and significantly delay wound healing. So principles of wound care in immunocompromised patients. So despite all the challenges that arise from being immunocompromised and treating chronic wounds, there's really a lack of available clinical guidance when treating these wounds. So we really need to be using our clinical judgment to choose the best treatment, and continuously assessing the wound is super, super important, and just making any adjustments for anything that you're seeing. Okay, so the following principles should be kept in mind. Aseptic technique, so reducing the risk of infection as much as we can. Selecting the appropriate wound dressings, so something that is going to keep it free from any external contaminants, infections, physical damage. Okay, wound assessments on a continued basis, so keep looking at the wound and assessing it each time. Use of antimicrobial or antibiotic agents to reduce the amount of bacterial contamination in that area. And nutrition. So we want to optimize nutrition, optimize the patient's body so that we can optimize healing to the best of our ability. So there are some advanced wound care solutions that we can use in immunocompromised patients. So things like growth factors. So these help kind of push the wound along and get it to start healing. Okay, so we can do that. There's also skin substitutes. So we have our synthetic or our real skin substitutes that we can be using to just cover and protect different clothes, because some are permanent and some are just used temporary. So it just depends on what we're using and what the clinician decides with the skin substitutes, but those are things that are available. So that's all I have for this video. I really hope it did help you kind of understand immunocompromisation and wound care and how it's affected. But that's all I have for this video, guys, and I'll catch you in my next one. See ya.